So
I thought we thought it might just be helpful just to begin with, that if I gave you a little bit of an overview of who we are here in Leeds and what our service looks like. And then I'll be handing over to Bal for her to share with you some of the work she's been doing in terms of her clinical engagement, access and inclusion coordinator role, and how she has been working really hard to kind of expand that role in recruiting volunteers, people with lived experience, getting out into the communities, into our faith centres, and making links with our faith leaders to really try and reduce some of those barriers to access for the mums and families here in Leeds. And she's actually been really successful in the work that she's done. So hopefully you'll find that interesting, some of the stories that she has to share. Hikmat will then hopefully be joining us, fingers crossed, if technical issues are resolved, and she'll be sharing her journey and the work that she's also been doing with us as a service. And then at the end of the session there'll be some time for questions if you have any, but if you've got anything kind of to ask as we move through the presentation, through the workshop, please do just stop us and ask, and we can keep an eye on the chat as well as we go on. I tend to talk really fast, so if I'm speaking really fast, I'm not making any sense, then do let me know, and I'm happy to go over kind of what I'm saying again. I'm just very, very aware of how I speed through things. So as I said, I'm the clinical team manager of the Perinatal Service in Leeds. And we actually have 3 strands to our service as a whole. So we've got our mother and baby unit that services the whole of Yorkshire and Humber. So that's 8 beds for the Yorkshire and Humber region. And that sits alongside our community service that I manage. And where we have, like many other community services, perinatal services, we have rapidly expanded over the last 3 years. We're now a team of around 40 staff from a mixture of disciplines. So within that we have our medics, our consultant psychiatrists, we have a psychology team, deliver a range of therapies such as EMDR, CBT, DBT, couples counselling, family therapy. So we have a whole suite of support and interventions that we can offer the families that we work with. We have our care coordinators, so our CPNs, social workers and occupational therapists. We have peer support workers that we've also expanded our team of more recently. So those are our staff with lived experience who are really out there kind of on the ground trying to work alongside our families to get them engaged in the service as fully as possible. And we're really trying to push forward with a co-production model of delivering much of the work that we do from a group level, and our peer support workers have been instrumental to that. We also have a nursery nurse, social workers, so a whole plethora of professionals really that work with the service and deliver what I feel is a really good service to the mums in our community. But what we realised was that we still weren't seeing a huge number of diverse communities kind of coming through the service. And for those that we were seeing, we noticed that there were a number of barriers to access. And those could be things like practical barriers, not being able to get into the service, for example, financial deprivation. But a lot of the unknown, if you like, was around kind of the cultural impact and understanding of a family, and their understanding of what having a mental illness might be and what access and support might be about, and not really feeling that, you know, there's enough information out there really to help the families that we want to be working with access our service in a way that would be useful. So that's where Bal's role came in. So Bal joined us around 3 years ago, and we really wanted to take an engagement approach with Bal's role. So getting out there and really getting alongside our communities to find out from them, you know, what the issues were, what can we be doing as a service to be meeting the needs of the diverse communities in our area. And Leeds is very culturally diverse. which I think is wonderful because it gives us a real opportunity to get out there and really get alongside lots of different communities and hear their voices in order to shape our service moving forward. And so that's the work that Val's been taking a lead on, and she's going to go into a bit more of that in a moment. I think what's useful just to highlight, and I think that the reason that we're all here is that we're all very much aware about the racial disparities in maternity care, and the Embrace reports from 2018 to 19, and again more recently in the most recent Embrace report that didn't show any kind of significant difference in the statistics around people's experiences in maternity care from diverse backgrounds. That is that Black women are 4 times more likely to die in pregnancy or childbirth in the UK compared to white women. Asian women are twice more likely to die in pregnancy or childbirth in the UK compared to white women. Women from a mixed ethnic background are 3 times more likely to die in pregnancy or childbirth compared to white women. And it goes on. And I think we really need to hear and hold those messages in mind, because we really do, across the board, as we all know, need to be doing more to try and not only find out and understand more about why this is and dig deeper into those issues, but also do our bit really in trying to support these families and make a difference. So that's a little bit of what we're trying to do here in Leeds. I'm not sure if anybody has any questions about the service as a whole, but if not, then I can hand over to Val, who will be sharing some of the work that she's been doing.
Thank you, Tara. I'm not sure if there's any questions. If there are, you can use the chat, or just please feel free to just come in. Okay, if not, what I'll do, I'll start off with some information about what I've been doing there within my role. So thank you very much for that, Tara. So as Tara kind of highlighted, the reason for my role coming into the service, at that point, 3 years ago, it was very much highlighted by our data, was that there was an absolute need for a clinical inclusion coordinator to help support the service, because what we noticed was the disproportionately low rate of women from diverse cultural backgrounds accessing our service, and we needed to know why that was, what the challenges and the barriers are, and how we can really improve that and really raise that awareness within diverse communities, really. So my role very much involves raising the awareness of perinatal mental health illnesses within our diverse communities. It's about improving people's access into our service, and I support the frontline and leadership teams to provide a culturally responsive service. So making sure that we're all able to make sure that we are meeting the cultural needs, whether it's cultural needs, religious needs, spiritual needs of our diverse patients, but also looking at wider protected characteristics as well, to make sure that we're really making sure that we're meeting people's needs. So as you can see from my slide here, I've been working really creatively alongside our team to make sure that we are reaching out to people on a real grassroots level here, and in the heart of their own communities. And by doing this, what we were doing was we were creating an open and safe space for people to be able to come along and have the opportunity to talk to us, be heard and listened to, because it's so important for us to be able to really fully understand what's impacting on our community, what are the challenges, what's actually stopping people from actually coming out and reaching out for that support and that help, and how we can really improve that and work together on improving those outcomes, really. So as Tara mentioned, I started my role right in the beginning of the pandemic 3 years ago, and at that point it was almost like, oh my goodness, how do I actually go out and engage our local communities when I'm actually stuck at home? So I had to actually think really creatively at that point, and what I did was I did a bit of research and thought, right, okay, let me try and connect with our communities whilst everybody's at home. And I reached out to 2 local South Asian radio stations, because we identified really quickly from looking at our data of 2 communities that we really needed to focus on at that point. And the communities that we identified are the Muslim community and the Sikh community. So that's not to say that we won't be actually going out to reaching out to other minority ethnic communities as well. We absolutely will, but the fact is that we need to do this in stages and it takes time. So we need to really do this slowly. So in order to reach out to these 2 particular communities, that's why I reached out to Akash Radio Leeds, which is predominantly for the Sikh community, and Fever FM, which is for the Muslim community, but again, it's for general South Asian community. So we knew we had the listeners there. We knew we had the audience already there. So what I did was I went on the radio every single month for 6 months. And did radio interviews, holding conversations in community languages that people actually understood, which was really meaningful and really important to us. So having conversations in Punjabi, whether it was Urdu, whether it was Hindi, as well as English, and taking professionals with us along our journey to share that information with our audience, with our community, really. So I took on health professionals from our service, so took on medics. So as you can see from the slide we have got next to me, I had Dr. Madhu Gable Ramani, also Dr. Seth Bangash as well, who came along on the radio stations with me, and to hold those conversations, as well as taking on midwifery, whether it was people with lived experience as well from our service, which was really important, because that is where the connection was really made, was people were able to fully understand, well, actually, I'm going through this, I'm going through these kind of feelings at this moment, and this is how I can actually go out and get some help. And to notice that there's somebody who is from a similar background to myself, who's actually also going through this and is getting that help, was really, really powerful. So alongside those radio stations, we also took on influential faith leaders, so people from the local community that I knew would actually have a great impact, who've already got that trust with the community, and who would be able to support us along our journey as well, to hold these conversations and raise why it's so important for people in our community to be able to come and get that help, but also help us to break down that barrier and that stigma and that shame, which equally can prevent people from getting that help. So normalizing these conversations was really, really important, and it was an absolute hit. We got such positive feedback from the local community about this. One of our biggest projects was BBC Asian Network. So it flourished in terms of the media side of the element for our work, and the engagement side, because we started to then gain an interest from other media aspects in terms of, BBC Asian Network, we did a huge piece of work with them, and just from one of the interviews alone on their Facebook page, we had around 19,000 video views just from that segment. And Fever FM, that we were reaching out to and did radio interviews with them, their audience is 80,000 people locally. So you can just imagine in terms of the reach area that we were reaching there and having that impact. So that was just one side of it. And then we started to do interviews with local newspapers, managed to get onto BBC Lux North, various other radio stations as well. And again, taking people with that lived experience along with us on this journey, really, really impactful. So that was just one side of it. The other side was we started to go out and connect with places of worship. So along on this slide, you can see photographs of local gurdwaras that we started connecting with and going along to. So every single gurdwara, Sikh temple in Leeds, we were there. We started to have a presence there. We were visible. We were holding health and well-being stalls to be able to share that information about the service that we provide and what the signs and symptoms are to kind of look out for as well. So that has been really, really well received, as well as going to the local mosques as well, and working with our faith leaders has been a real great insight into helping to break down those barriers really and those challenges. Also, we've been asking our service users to get involved in the work that we've been doing. So really asking our service users to write service user blogs, do podcasts with us. We've created videos, so lots of kind of media influential kind of outputs that we've done to really reach out on a wider scale as well. Can I have the next slide, please? Can I have the next slide, please? Is that okay? Oh, just the one before that, please. We just moved on a little bit quickly. There was just one before that one, Robert, if that's okay. Thank you very much. So here's one around working in partnership with our faith leaders. So we know when it comes to engagement, you know, from listening to our service users, a lot of the mums and the families have shared how it's so important to go out there and go and talk to our community. That's exactly what we've done. And a lot of our service users have shared equally as well, is that it's in order to break those barriers, we need to look at speaking to the older generation as well. So hence why we're going to the places of worship, but also speaking in a community language that people will really understand from that level, really, which was so needed. So this is why we're another point of why we've started to reach out to places of worship, because it really helps that community connection as well. Also, equally, that, you know, we understand that faith and spirituality can play a significant part in a person's life, especially when it comes to health and well-being, and also aiding recovery as well, you know, and therefore engaging our places of worship and building those positive relationships and trust is so important going forward, really. Can I go into the next slide, if that's okay, please? Thank you. Within the places of worship, what we started to do as well is hold mental health workshops. So this is something that we've recently been doing, and we're still continuing to do at this moment in time. We started them off with the mosques. So here you can see in the photograph is one of our pictures of one of our mental health workshops that we did there, and that was around we started off by talking about perinatal mental health, taking in our consultants along with other members of our team as well. Hikmat was part of this event as well, and she was able to share her lived experience along with her husband as well. So sharing it from a whole family kind of viewpoint was so important, and the feedback was absolutely amazing. I think, you know, to be able to, for people to be able to connect, they absolutely connected to Hikmat's story there, and wanted to hear more, and they found it really beneficial in the aspect of, you know, this is where more conversations need to be taken place. I think we often think about how can we go out and how can we go and engage people, how can we engage communities? Well, this is where our communities are saying, come and talk to us, come and talk to us in our places of worship, where we know it's a community setting, this is where everybody will be together. And it's an ideal place to break down those barriers, but also normalise these conversations. From these working in partnership with our faith leaders, what we've also picked up along the way is I've connected along with other smaller little groups that are already taking place in our places of worship. So, for example, there was a mother nurture group in one of the Sikh Gurdwaras, a local group that was created by a mum in the pandemic, and she's now got about 40 mums on her WhatsApp group that she created as part of health and well-being, really, just allowing a safe space for mums to connect together. And I connected with this mum and this group to be able to, you can see a picture on here on the top right hand side, where that is the mother nurture group. We went in and we shared some information about perinatal mental health, and had conversations and listened to what our community needs are, and what people feel, you know, can stop people from accessing help. From this as well, we've also connected with a Seek Mental Health and Wellbeing organisation, a 13 community clinic. Again, these are non-profit organisations which have been created within the heart of the community. So these are already, you know, local groups that are taking place, which is so important for us to be able to connect together, work together to then help us create these mental health workshops, which not only are we sharing about perinatal mental health, we're able to talk about general mental health as well, because this is the feedback that we're getting from our local community, is that yes, perinatal mental health is important, but equally, what about, we'd like to learn about other aspects of mental health disorders as well. So men's mental health was a huge topic that came up for us, that, you know, our community is asking for us to share some information on. So that's another area that we will be putting as part of our workshop. And the final aspect of the workshop is to basically do a mental health first aid workshop with our community as well. So it's giving back to our local community as well, and giving our community the skills and aiding them with that knowledge, and empowering them with that knowledge to be able to support our local communities and know them. It's about signposting, so helping them how to signpost. If somebody is needing some support, this is where, you know, they can go and get that help, and it's working together with our community. Can I have the next slide, please? Thank you. So these are some of our key findings that we're learning. So we're on a journey at this moment in time. We're still on this journey, and we're still learning as we go along. But some of the barriers to accessing support that some of our community members have highlighted to us are these key factors. So embarrassment, too scared to go out and get that help, too afraid, too ashamed of what other people in our community are going to say about them if they were to go and get that help. Lack of confidence, don't feel that they're able to actually go and get that help. They're too afraid. Judgment, being judged again. You know, it's a lot about what will the community say? What are other people going to think of us? Again, it comes down to that stigma and that shame around having a mental health illness. You know, often people will share with us that just the term mental health can, in some communities, translated means that you're crazy. And then if people are thinking, you know, that no one's going to associate with being crazy. So those are kind of the barriers of actually going out and getting that help. Feeling outcasted by everyone. Personal guilt, feeling that you're not worthy of getting that support, that, you know, this illness, it's your own doing. You've brought this illness on by yourself. Fear of your children being removed. This is a huge aspect that we're hearing from our community, is they're too scared, thinking social services are going to take their children away from them if they go and get that help, which, you know, is a huge barrier in itself, really. So it's about sharing that information about actually, you know, how social services, breaking that stigma around social services is huge. So this is where I take along social workers from our team to go out to our places of worship to, you know, help break down that stigma, really, and help aid those conversations, which are really, really important, and that reassurance that actually, you know, this is not the situation. It doesn't mean that your children are going to be removed. You know, it's about really reaching out for that support, really. A lack of awareness and understanding, and I think that's where it all comes from as well. You know, not really fully being aware of what perinatal mental health is, but also how to even go and get that help. You know, it's really, really important. Superstition, you know, this is where it comes down to the cultural aspects of it. You know, an evil eye, has somebody casted a spell on you? Is it black magic? These are all real things that, you know, people feel in our communities that, you know, we need to be hearing, but also equally, how can we help support these conversations and showcase it from a medical perspective, that actually, you know, we're not dismissing that this is absolutely fine if this is what you believe, and these are people's belief systems. It's not about taking that away from somebody, but it's about equally empowering our communities with the knowledge to fully understand this is how somebody can become unwell, and how, you know, faith and spirituality along with medical intervention can work hand in hand together. That is what we are promoting. That is absolutely what we are going out and sharing out there with our communities. You know, the shame and the rumours and the bad feelings, again, is what our communities are saying. Professionals judging people's religions and cultural backgrounds. So the fear of somebody, a professional, making that judgment, pre-judgment already, of, you know, stop it. This is what can really stop somebody from actually going out and getting that help as well. So, you know, we need to work on that. Those are areas that we need to really think about, really. Again, it can come down to, you know, those biased behaviours, unconscious biased behaviours, racism, discrimination. You know, these are all things that, you know, people in our communities may have faced, and that is actually stopping them from actually going out and getting help. And it comes down to that trust, and it's building that trust, which is really, really important. And that is something that we're doing by going out and being visible within our communities. So those are just some of the barriers. There's so more, you know, there's so many more, such as a GP. A lot what we're hearing is the first point of call of just going to the GP, which you'll hear more from Hikmet when she shares her journey as well, is a huge barrier where, you know, people are feeling that they just can't get past the GP because the GP doesn't fully understand what a perinatal mental health illness is. So what's happening is they're being delayed. That process is being delayed, and then they're coming to us at a crisis point. So there's a lot of work around training health professionals. More training is needed around identifying, you know, signs and symptoms much earlier for our patients and our communities. And we do deliver training within our service to wider professionals as well. We deliver it 3 times a year. And GPs are absolutely on our list to really reach out to, because we know this is an absolute gap here. This is something that's a huge barrier that has been identified by our community. So how can services be more accessible? So some of the things that our members of our communities have identified are some of these, which have more awareness sessions in places of worship or community centres. So, you know, sometimes we often hear the notion of our community is really hard to reach communities. Well, actually, our work has actually proven that they're not hard to reach at all. You know, it's about being visible. It's about going out there and holding these conversations, which is really, really important. And, you know, our communities are wanting more of these sessions. So this is an absolute way going forward, really, and holding them in local community centres as well, where we know ideally where people from diverse communities, you know, are living. That's really important to be able to help engage them as well. So, you know, focusing on diverse areas that was highlighted there. Having leaflets in GP surgeries and pharmacies with eye-catching slogans, you know, that's something, again, you know, you go to the pharmacy, it's not something that we necessarily see. I've not seen it as such. And it's something that has been identified for us, and something that we're working on, really, is a definite need. You know, someone is able to see a leaflet or a poster whilst they're going to a chemist, to be able to actually see that, you know, that may actually prompt them to go and get some help. So it's looking at those kind of things going forward, really. Midwives and health visitors to provide easy to read information. What we've identified and noticed is that our service users, as well as members in the local community, are saying that actually, you know, they would like more of this. They're not seeing enough of it. There's not enough information out there on perinatal mental health at this moment in time. I'll go on to explain what we're doing with our the work that we're doing with our service users, as well as our volunteers and our peer support workers, is working with maternity services, and we're in the process of creating an information leaflet on perinatal mental health to put into maternity packs, because in maternity packs there isn't nothing around perinatal mental health. So that is something that we're creating at this moment in time, and that is going back to, you know, the feedback that we're receiving, really. Myth busting around medication and side effects is a huge thing. You know, that's the barrier that is stopping people from getting help. You know, thinking people are worried and they're going to get addicted to medication, or there's going to be huge side effects which are going to impact on them, on their health and well-being. So it's around really looking at how we can you know, really demystify all of those kind of conversations, really. Professionals to speak in community languages, and this is a huge one. It comes down to representation again, which you'll hear a little bit more when I go on speaking around, you know, recruiting that diverse workforce is really, really important. A lot of what we've noticed and the feedback that we've had when going out to places of worship is people are asking us in the community, so have you got a doctor in your service who can speak a language similar to mine? Have you got someone who looks like me, a professional who can support me, who I can feel comfortable holding these conversations with? And that's something that we can actually say, because like Tara identified right at the beginning, is that our team has grown so much, and we are starting to recruit, you know, a much more diverse workforce, which is brilliant because we are able to support, you know, our local communities as well with this. And some of the feedback that we got, that we were capturing along the way, this is just a little bit in terms from holding these mental health workshops. So some of the people that attended, one of them says, you don't know how important these workshops are until you come. It helps to open your eyes and see you're not alone and that it's okay not to be okay. Another person shared how they were able to relate to lived experience, and that was in relation to Hikmat's story, really, and they found the workshop really helpful. Another person shared how education is so important to learn. So this comes back to, you know, helping to improve that awareness and understanding is really, really important. And they found it to be a fantastic experience, and more workshops are needed. So this is great for us as a learning experience, that actually this is just something we've started and we're continuing to do this with, you know, other places of worship as well. Can I have the next slide, please? So here I have spoken a little bit about recruiting a diverse workforce and the importance of this. And again, you know, it comes back down to, you know, listening to what our service users are saying, listening to what our community members are saying as well. What I've done along our journey is we've got volunteers that are real mums from our service who've accessed our service and wanted to come back and volunteer with us. So now we have them as our expert by experience, hence Hikmat is on our workshop with us. So we've got Sadif, Hikmat and Marilyn, who have been supporting our workshops, but also engagement work, but also helping to co-produce and co-design various information within our service. So whether it comes from a diverse mums group that I'll go on to talk about, or whether it's creating leaflets for the maternity services, creating videos that are educational tools. So really, you know, helping to have these conversations and working together with our service to make it more inclusive is really important. And along our journey, we've also recruited inclusion peer support workers, which is fantastic, because there was only me doing it in terms of the inclusion side. I mean, I've also, you know, working with the team, but it's equally quite hard. So now what's fantastic is we've recruited peer support workers who've got that lived experience, are in paid roles to be able to support our work as well. And the vision for the volunteers is that, you know, longer term is that we're able to give back and volunteers are able to go into paid work. So that's the idea of recruiting volunteers. So it's supporting, you know, their journey along the way as well. Can I have the next slide, please? Thank you. So the Diverse Mums Group. So what is the Diverse Mums Group? So this group I created when I first started 3 years ago within the pandemic. It's very much, for us, it was about listening to our service users, and like Tara mentioned, in terms of the stark inequalities that we were hearing and continue to hear around, you know, how mums from diverse communities are more likely to suffer from perinatal mental health illness, but also equally, you know, the tragic inequalities that come along with it. We felt that we need to provide some kind of culturally tailored support within our service, and this is why I put together a Diverse Mums Group, and this was co-designed and co-produced with one of our volunteers as well. It's a group which is created to specifically for mums from diverse ethnic backgrounds to be able to connect with one another and share their cultural experiences together, and build those friendships, build that self-esteem, help break down those stigma and that shame, and normalise conversations around mental health going forward, really. So this is an 8-week programme, which initially it started off with just a 6-week programme, but the feedback that we got was it absolutely helped the mums build their self-esteem, self-confidence. They were able to, connect with other mums. They built friendships with other mums within the group, and they really, really benefited. It uplifted their mood, and it aided their recovery as well. So the fact is that they wanted more sessions was great for us as a learning curve, really. So that's what we did. We are now doing 8-week programs. We've just gone into the community. We're based in a children's centre, which is fantastic as well. So it's in the heart of the community. We're based at Gipton South Children's Centre in Leeds, which is brilliant. So this is really important about providing culturally tailored support, but equally putting it out in the heart of the community, which breaks down that stigma and that shame straight away for our communities as well, which is really important. And it was set up, like I said, alongside our volunteers. So it was co-produced, but alongside our service users. So I initially did questionnaires. I spoke to mums. We spoke to about 15 mums over the telephone. I did a questionnaire with them, asked them what their feedback was. Would they like this kind of group? What kind of stuff would they like us to talk about and address? And how can we make it so it actually meets their needs? And from that feedback, this is how this group was created. This group, within the first year of us setting it up, we won a National Service User Award for breaking down barriers, and that is purely because what the mums have fed back on and how much of an impact it has really, really made. It's been an absolute lifesaver for some of our mums who have shared that information coming back to us. So yes, it's something that I'm really, really proud of, and it's really great to have something like this within our service as well. Can I go into the next slide, please? So I'll talk about our key findings and the key themes that came out of the diverse mums group. So these are the key themes, some of them that came out of it. So social factors, it helped to reduce isolation. It empowered our mums. Our mums felt they were able to share their lived experiences together. They felt safe enough to be able to share that experience. They had a sense of belonging within that group. It improved their self-esteem, self-confidence, friendship WhatsApp groups were created within this group as well, along their journey. And some of the cultural factors that came out from this group were around expectations, family pressures, community perceptions, gender roles, lack of awareness, the stigma and the shame, the importance of normalising mental health and breaking down those barriers were key things that, really shone for our service users. Some of the religious factors that came out were around how faith and spiritual belief systems are really, really important for our service users. Demystifying some of the myths that can stop and prevent people from accessing support. Addressing some of the religious norms, cultural and religious misconceptions that can stop people coming forward for that support as well. And some of the barriers were around the lack of trust, lack of culturally responsive services, family honour, patriarchal and intergenerational viewpoints, cultural influences, and denial that having a perinatal mental health illness can actually even impact on somebody from a diverse background. Health inequalities, racial discrimination was identified, stereotypes, biased and unconscious biased behaviours from health professionals, lack of cultural awareness amongst professionals, cultural and religious factors not being explored. So these are some of the factors along people's journeys that they shared from the maternity services coming through into our service that people really shared with us and highlighted how things really need to be improved. Have the next slide, please.
Sorry to interrupt. Just to let you know, we've got 15 minutes before the end of the breakout room. Yeah,
thank you, Sarah. I'm just quickly going to wrap up in terms of social factors. As you can see, these are some of the key things that mums have highlighted. So you can see here it's around cultural sections in terms of their struggles there, having to feel overcompensated for having to explain themselves to being being compared into a white group compared to being in a group where, you know, it's culturally sensitive or culturally appropriate. Again, in terms of you know, whether they believe in a shaitan or a devil inside them, you know, and the stigma and shame around that. Can I have the next slide, please? So cultural factors, you can have a read of those. I won't go too much into this because I'm conscious of the time that I have. So again, you know, it's around how people are feeling, that, you know, the barriers that can stop them, how mental health is not even perceived in some cultures. Can I have the next slide, please? And religious factors, again, it goes back down to in terms of lack of faith. You know, do I not believe in God enough? Is there something else I should be doing here? I'm going to the next slide, please. Again, some of the barriers, we've touched upon these barriers here. You know, about it took courage to go and speak to a GP, but getting past your GP was a huge challenge. So, you know, it's highlighting the barriers again here. Can I go into the next slide, please? Health inequalities, again, it comes down to, you know, we've addressed in terms of, you know, racism, discrimination, how, you know, people not feeling that they're heard or not feeling listened to. And that's really, really important, that we need to improve that and work on that. Can I go into the next slide, please? So what's important to our mums? Here they've spoken about trust, representation, be heard and listened to. I will share these slides with everybody afterwards, so don't worry, we'll get these out to you all. You know, and more engagement, more awareness is needed. So it's about going out there. People are wanting us to go out and share that information with them. You know, they want to be heard. They want their cultural and religious and spiritual needs to be heard and listened to and taken into account in terms of their care. Can I have the next slide, please? So our diverse community is really hard to reach. I'm hoping that you've all fully understood that actually the work that we've been doing has really shown that this notion is absolutely, it's a no. You know, our communities are actually saying, come out and speak to us. We want to learn. We want to have that representation coming out. And we want to know how we can access that support. So it's about how we need, as practitioners, you know, we need to learn about how we can start changing the language that we're using, because often it's the practitioners that can be the barriers. It's not the community. Next slide, please. So every story matters. So talking in my language matters, and the group provides me a safe platform to do this. We are not crazy. Our illness is validated. We are heard. We are human beings to be heard. Having the group is a lifeline. This is what one of our mums said from our group. So sorry, that was quite fast. I will share these slides with you, but thank you for listening. And I'm going to open it up to Hikmat now because I'm conscious of the time, and then I'll take any questions afterwards if that's okay. So Hikmat, over to you.
Hi, everybody. I think Val covered a lot of it. So I'm just a volunteer with Val. And as I like to say, I'm a graduate from the Diverse Mums group. I was part of the group at one point, and here I am sharing my story of how there's light at the end of the tunnel. And I think going into it was really difficult to get help because I didn't know how to access help. And I accessed help through my GP, and it took me over 2 months of going back and forth to the GP 4 times, breaking down, letting them know something is not right until I was actually heard. And this is something that we constantly talk about in the group, is just getting the information out there for mums to know where to access help and how to access it, and just destigmatizing the idea of mental health and it's not good for you and all that. And another point was, I come from a Muslim background. I am an Arab, and with my partner, it was really hard for him to understand what this was. I remember when I first told him, he just said, "Oh, you just need some more sleep." And it's like, no, it's a lot more than that. And within the service, what we found is there's help for the partners as well. And having that help for my husband really helped him understand what I was going through, which was kind of what helped uplift us out of that situation as well. Because sometimes when you're fighting this all by yourself, it just makes things a lot harder, especially coming from, you know, people say you need a village to raise children, and sometimes you don't have that village, especially if you come from abroad, you're here by yourself, you don't have family. So finding this group was a village, finding the service was a village, finding support from my husband and for myself was a helpline. And that's kind of what really helped us. And yeah, there's different things within the service and within what Val does that really, really helps bring families together and give them the support that they need, that they can't necessarily find within their own community, within their own family, within their own little social circle. It's just creating a safe environment for moms that feel like they don't have it. And that's just what we're a bit about. So I'll open it up to questions, because I know there's only like 9 minutes left and lots of people are keen on asking questions.
There's been a couple in the chat. I don't know if it would be helpful maybe to read them out. So Rachel Burden has asked about the work that we do with partners. So kind of alongside the work that Val does and as a service as a whole, we do have a partner support side of the service, if you like, that we've implemented over the last 12 to 18 months. So for any mum who is accessing support from the service, we offer a partner assessment, and that's with a band 6 or above clinical practitioner. And it's an appointment where they then themselves can come along and discuss their own mental health. From there, it's decided what type of support they might need in their own right, or as a family as well. So some of the actions that can come from that meeting can be for the partner to be referred to our partner peer support worker, Errol Murray, for some one-to-one support, or for them to access our partner support groups that run weekly. And we tend to rotate them on a weekly basis as to what that support might look like. So one week is a social, where we might do an online quiz, or they might go out and play golf, or they might do something, go for a walk. And then the other week we might have a speaker that comes along. So one of our psychologists might come along and offer some help around managing your own mental health emotions. And then we might have one of our psychiatrists that come that share information about perinatal mental illness and what that might mean for their partner, but also what it means for them as a family as well. And then if it is kind of found within that assessment that further mental health support's needed specifically for the partner, then we work really closely with the Leeds Mental Wellbeing Service and also with the GP primary care mental health practitioners to get those partners signposted in for their own support in a timely manner, really. So that's the work that we're doing with partners, and that's across the board as well as for our partners from diverse communities. One of the we've been asked if we could share details so that outside of this workshop we can share more ideas and thoughts about the work that we're doing. We're more than happy to do that. I think Val gets inundated with requests for further information about the work she's doing, which is great, because we really do want to be working together across the nationally, really, with our partners. And we've been wondering about how we might be able to do this in a more timely way. So I'm wondering whether, if we facilitate some further workshops outside of this, really, whereby we can invite practitioners along and we can share some ideas together about how we might want to continue this work and how we can support you guys in doing something similar, or, what we can learn from you in the work that you're doing as well. If you are interested in that, I'll share my email address outside of this, or I can put it in the chat now. And I'd be more than happy for you to get in touch with me, let me know. We can collate some information, and then Val and I can meet together with our peer support workers and think about what future support or events or information sharing sessions might be useful for everybody. So do let me know. Amy Hill?
Yeah, hiya. I work for the South Staffordshire Community Perinatal team, and we did a project last year on inclusion and diversity and how we can increase access to those communities. But I was just wondering, like, how have you found getting in with your like faith leaders and that, because we've kind of been met with very closed doors, we haven't got anywhere. They've not been willing to sort of engage with us. I think one of the challenges that we have is that a lot of our mosques and worship venues are very much used for that. They're just there for prayer. They're not like a community centre. Nothing really else goes on it, and it's mainly male orientated. But it's been a real, particularly the Muslim community, it's been a real struggle for our team to get any engagement with them.
Thank you for
See,
sharing.
Hikmat's put your hand up as well. Sorry, so I don't know, Bal and Hikmat, if you want to respond to that.
Hikmat, do you want to come in?
I just wanted to ask, when you go along to these places, do you take someone that is of a similar background?
Yeah, so we were funded for a 12-month project, and we had inclusion peer workers, and one of the ladies is from that background, and has had struggles with her community kind of moving forward with the times and things like that.
Yeah, I think what we found, Bal and I both, I think we've gone back and forth to specific places multiple times until we've actually broken through. And sometimes that has to do with management. Sometimes that just has to do with people listening. And I think what we heard was, yeah, sometimes we got to speak to some of the moms that were around during prayer time, which was brilliant. But what we had suggested was, if after male prayer times, if we got a male, so for example, my partner, which is willing to volunteer to go and speak out, if that would kind of help, and that actually pushed people forward to listen more, because sometimes, unfortunately, from a Muslim background, men will only listen to men.
Yeah.
So that it's something like that. So maybe you target, unfortunately, with diverse communities, they work a certain way and they have certain belief systems, and sometimes we just have to go along with these systems until we reach a point where we can kind of break through and then insert some differences. So I'll just hand it over to Bal, because she's been struggling with with this as well.
Oh, okay.
I think that's great, Hikmat. I was going to say the exact same, really. I think it is about being consistent and not giving up. And I think you've got to keep going back, you know, several times. There'll be certain mosques that you will realise which will be more open. Some mosques will be quite closed, and you can get that with any kind of faith. It doesn't necessarily just be from a Muslim faith. We try to go to some of the mosques. What I've noticed was, you know, I've been to many mosques in Leeds. We had 11 mosques in Leeds who said they are willing to work in partnership. So and that is by building that relationship, by going along, you know, and holding conversations about, you know, how we can work in partnership together. It's about working together. It's not us going in as an NHS and saying, here, we're the NHS and we want to come in there and we want to do these workshops with you. We want you to listen to us. It's not about that. I think it's how we hold the conversations. But equally, I go along to one of the mosques in Leeds at the moment. I go along to a fortnightly, it's a Baraka play group. So it's a mother and baby group that's actually taking place in the mosque. So it's finding out if there's anything happening. A mosque, you know, in places of worship, it's not just a place to go and pray. It's the heart of the community. They have lots of many social activities as well. So it's linking up. Sometimes about linking up with the right people and seeing what else is available there. So maybe try that, but don't give up. I've been doing this for over a year.
I think now with Ramadan, so maybe some of the mosques are just for prayers, but for Ramadan, now that Eid is coming, they will do something for that. Even if it's just a mosque that does prayers, they will have a gathering for Eid and like celebrate that. So maybe that's kind of a time to get in there. You know what I mean? Like find certain moments that you can incorporate something else, like, oh, okay, this is a celebration. So how about, look, we're here, we can help. And, you know, this kind of way is just finding that little gap that will just help you get in there.
And we did that. That's how we actually initially got in, was last year, Ramadan time. We were invited to one of their opening of the fast and we went along in the evening. So a lot of the work takes place evenings and weekends. So I think that needs to be taken into consideration, that this is not a 9 till 5 role necessarily. You know, it's really taking that time and dedication to invest in, you know, doing some of those evening visits when the community is actually available to maybe go and speak to you as well. So maybe try and give that a go.
Thank you.